Hey guys, welcome and welcome back to my channel. This is Dr. Prasanjit, currently JR2 in the Department of Pharmacology, AIMS Kalyani, and I am back with one of my journal club presentation. So without wasting any time further, let's get into today's journal club presentation. So in today's journal club presentation, I am basically presenting the article that is the use of telemedicine in the preoperative care of pheochromocytoma, which is basically a systematic review, and it was being published in the journal that is Curious. So this is basically a PubMed index journal. So let's begin first with the introduction and the background. So, as you know that pheochromocytoma, which is actually abbreviated as PCC here in this article, it is actually an adrenal medullary tumor which arises from the chromaffin cells of the adrenal gland, and it leads to increase in the production of catecholamines, and because of the increased production of the catecholamines, it leads to several adrenergic activities, because these catecholamines are responsible for the adrenergic activity leading to the symptoms, that is headache, palpitations and hypertension, which is seen in case of pheochromocytoma. So this is basically the reason for hypertension, palpitations and headache seen in pheochromocytoma. And if the pheochromocytoma is left untreated, then it is associated with significant cardiovascular morbidity and mortality. So that is the reason why this needs to be treated properly. So the mainstay of management of pheochromocytoma is basically open or laparoscopic surgical resection of the tumor. The process is, that is, it is basically the surgical resection of the tumor, that is pheochromocytoma is being resected out. But before the process of surgery, before the process of surgery, pre-operative management of the pheochromocytoma has to be done. That is, this surgery requires appropriate pre-operative preparation, that is to minimize the following things, that is to minimize the excessive amount of catecholamines which can lead to hypertensive crisis during the surgery, and by adrenergic stimulation, and to decrease the chances of the palpitations and all the cardiovascular morbidity and mortality associated with pheochromocytoma. So continuing with this, and you can see here the cornerstone which they have mentioned in this article. The cornerstone for the pre-operative management of pheochromocytoma is basically to control the blood pressure and the heart rate. And what are the guidelines? The Endocrine Society guidelines recommend that the patients with pheochromocytoma should actually get an alpha blockade, that is in the form of phenoxybenzamine, which is basically an alpha blocker, for about 7 to 14 days before the surgery, that is before the surgical resection of the pheochromocytoma, to achieve the optimal BP and heart rate. And what are the targets? That is, the suggested target for BP is less than 130 bar 80 mmHg when the individual is in sitting position, and SBP should be more than 90 mmHg when the individual is in standing position. Whereas the heart rate should be in between 60 to 70 beats per minute when the individual is in seated position, and it should be 70 to 80 beats per minute when the individual is in standing position. So this is basically the guidelines, that is the Endocrine Society guidelines, which actually recommends the use of alpha blocker, that is for 7 to 14 days, to achieve proper control over the heart rate and blood pressure before doing the surgical resection of the pheochromocytoma. And for doing this, that is for continuously assessing the blood pressure and the heart rate, frequent clinical assessment has to be done in the individuals to ensure proper BP and heart rate target is being achieved or not. So this places a huge amount of burden on the patients. That is basically, it creates a lot of burden over the patients for the travel, then the consultation. So that is the reason why the care of pheochromocytoma patients via telemedicine has been used, and nowadays it can be of value for such patients, so as to minimize the cost of travel, to minimize the cost of consultation. So this is basically this is basically studied in the particular article. So what do we mean by telemedicine? So here they have used the abbreviation of TM for telemedicine. So it is basically describing the use of medical information exchange from one side to another via the electronic communication to improve the patient's clinical health status during a remote clinical service. So what does it mean? It means that is basically the transfer of information through the electronic medium, and which helps in the management of the condition of the patient. So pre-operative preparation and titration of the antihypertensive medications can be done through the telemedicine in case of preoperative management of the pheochromocytoma. So, and it has demonstrated the less requirement of the preoperative visits. That is, earlier the individual used to visit the clinic on a regular basis for the follow-up, that is to look for the blood pressure and the heart rate following the consumption of the alpha blocker before the surgical resection of the pheochromocytoma. But now with the help of telemedicine, it has decreased the number of preoperative visits. As a result, it has decreased the risk of infection and also high safety in the management of complex cases. And how has it decreased the risk of infection is that during the COVID period, the most of the studies which are included in the systematic review were done during the period of COVID. So that time, if the individual had a chance of using telemedicine, so in that case, it would have decreased the risk of infection for that particular patient. So this systematic review aim to discuss and summarize the available data which is present on the effectiveness and safety profiles of different types of telemedicine practices. That is, it can be synchronous, asynchronous, or remote patient monitoring in the pre-operative management of pheochromocytoma. So the different types of telemedicine, I will be discussing that in the upcoming slides. So coming to the methodology of these systematic reviews, so let's first discuss about the search strategy. So basically, two reviewers independently searched for relevant articles which are published till the date, that is November 5, 2022, in the different databases, that is PubMed, Cochrane Library, and Google Scholar. And the search terms which were being used, that is, on one arm it was telemedicine or telehealth, and on the other arm it was the disease, that is the pheochromocytoma. So all types of telemedicine were included, that is the synchronous type, asynchronous type, and the remote patient monitoring. And what are these types? I will be discussing that in the upcoming slides. So this was about the search strategy. Now coming to the inclusion and the exclusion criteria in the systematic review, like what sort of studies were being included and what sort of studies were excluded from this systematic review, and what were the outcome measures. So articles which discuss the preoperative management of pheochromocytoma by using the telemedicine and was being published in English literature should first should be the first condition, and following that it should have a clear diagnosis of pheochromocytoma. That is, if the patient is not diagnosed to be having pheochromocytoma, then in that case we will not select that particular article. Then there should be utilization of telemedicine for the preoperative care of pheochromocytoma, and the outcome of the surgery, that is the surgery which was being done later on, that is the resection of the pheochromocytoma, whether it was eventful or uneventful. Eventful means there were some complications, and uneventful means there were no complications following the surgery. So it means the preoperative management is better. So if the preoperative management is done properly, then the surgery will be uneventful. So if the preoperative management was not done properly, then in that case the surgery might be eventful. So articles which were exclusive to consultations, that is basically where the patient is going to the clinic and for the follow-up visits, they are going and consulting the doctor. So in that case, those type of articles were not included, because here we are studying the intervention, and the intervention here is telemedicine, not direct consultation. And the primary outcome, as I've already mentioned in the systematic review, was the success of the surgery, that is whether the surgery was eventful or uneventful. So eventful means there is some complication associated with the surgery, and uneventful means successful surgery. So this was about the inclusion and exclusion criteria and the primary outcome measures. Now let's discuss about the prisma for this particular systematic review. So as you can see, initially the number of records which they found, that is, it was 5 from PubMed, then 59 from Google Scholar, and 0 from Cochrane Library. So all the 64, that is 59 plus 5, which is equal to 64 articles. So 64 records were being screened, and as a result 56 were excluded from that, and then 8 reports were sought for retrieval, and the number of reports which were not retrieved were 0. So it means they found the details of all the 8 studies, and then these 8 studies were being assessed for eligibility, and finally in these 3 studies were excluded. That is because in those studies there was no utilization of telemedicine for the preoperative care. So a total of 5 studies were finally included in this systematic review. So what are those studies? I will be discussing that later. So this is basically the prisma, that is how they have selected the number of studies for this particular systematic review. At the end, they were with 5 studies for this particular systematic review. Now, coming to the search, so 5 results, as I have already mentioned in PubMed, 59 results in case of Google Scholar, and there were 0 results in case of Cochrane Library. So, after excluding the duplicates and evaluating the articles for relevance, so they finally found how many articles? Total 5 articles which were included in this systematic review. So out of that, one was a case control study, one was a case series, and there were 2 case reports and 1 letter to editor. And all the studies came from either United States or Italy. So this is basically the distribution of the studies and what type of studies were being included. That is, out of those 5, it was one case. There was one case control study, then one case series, and 2 case reports, and 1 letter to editor. And most of these studies were being done in these 2 countries only, that is United States and in Italy. Now let's discuss about the data extraction procedure. So the authors, they cited the articles details in the Excel spreadsheet. So in Excel spreadsheet, they have included all the details of the particular studies which they have selected. That is the 5 studies which they have selected for the systematic review, and based on the following things, that is, under the type of study, they have actually included the modalities which were being used, then the results which were obtained from that particular study, and what were the limitations of those particular study. So this is about the data extraction, that is the limitations. They made the columns, and for each of the study, that is all the 5 studies, they have found out the modalities of treatment which were being used for the management of for the preoperative management of the pheochromocytoma, then the results and the limitations of those individual studies. Now let's discuss about the results of the systematic review. So as I have already mentioned, total of 5 studies were being included, and the majority of the included participants were females aging from 17 to 86 years, and physicians followed their patients via all the different methods of telemedicine. So it can be synchronous telemedicine, that is through the phone. Here basically the individual and the doctor is having conversation at a particular time, so the patient gets the output from the doctor, so patient gets the information from the doctor then and there itself. So it includes basically phone calls and the video calls. Then asynchronous telemedicine, that is, in this the individual transfers the information to the doctor, then the doctor can reply back to the individual after some time, so that is via the mail. And then we have remote patient monitoring. So in this, the several applications like mobile phone applications are being used for continuous monitoring of the patients for whom the surgical resection of pheochromocytoma is being advised in the upcoming days. So this is about the results. Now let's continue with the results. So the follow-ups for most of the patients were confined to twice weekly. That is, for most of the patients of pheochromocytoma who were undergoing this preoperative management with the help of the telemedicine, they were being followed up twice weekly, excluding the pregnant patient who was being followed daily. So basically, they have said that is, they have found this from the studies that the ladies are being followed daily, whereas the other individuals are usually followed twice weekly. And the preoperative duration ranged from 3 weeks to 10 months in those studies. An interesting thing is that all the 5 articles which they have retrieved, they reported successful, uneventful surgical procedure. That is, there were no complications associated with the removal of pheochromocytoma after the preoperative management with the help of telemedicine. So this basically proves that telemedicine can be of great use. Then let's discuss about the characteristics of the individual studies. So first we have the study by Jap et al. So it is basically a case series. So in this, they took the cases of 3 different females of age 60, 67 and 84 years, and they were having the following comorbidities, that is hypertension with prediabetes, hypertension with primary hyperthyroidism, then hypertension with hypothyroidism, dyslipidemia. So for all these they have selected the particular medications which is responsible for decreasing the blood pressure in the preoperative period. So they have used calcium channel blocker like amlodipine, then they have used alpha blocker like derazosine, along with beta blocker, that is like metoprolol. Then they have also used calcium channel blocker again. So these are the drugs which they have used, and the different types of telemedicine which is being done is either is synchronous and again synchronous. So for all the 3, it was synchronous and it was basically a phone call. On the other hand, the first visit, that is the initial visit, in the first case it was via the video, and for the other 2 cases it was directly the physical one, that is the patient is actually directly going to get the consultation from the doctor. So this is the characteristic of all the three cases, and for all the three cases it was twice weekly follow up, and the duration it varied, that is from 7 weeks, 12 weeks, then 18 weeks, and for all the three cases the surgeries were uneventful. So then we can discuss about the case control study by Heslin MJ et al. So it was conducted in USA. Then here the female to male ratio, that is 9:5. So a total of 14 participants were there who got the telemedicine. So here they have not mentioned about the comorbidities, but the drug which they used was alpha blocker, but which alpha blocker was not being mentioned. So initial visit was a physical one, that is the consultation. Then later on the type of telemedicine which they used was asynchronous type of telemedicine. So it was basically conversation via email, and it was being followed, that is the patient were being followed twice weekly for 4.7 weeks, that is before the surgery is being done, and here also the surgery was uneventful. So this is about the description of the first two studies. Now let's discuss the rest three studies by Zampeti B, then we have UR, and then we have Saksa D. So in all these cases, that is, one is a case report, other one also is a case report, then this is a letter to editor. So they have different comorbidities as you can see here, so I'm not going to read those. It is basically the result of all those five studies which were being included for the systematic review, and the drugs which were used, basically it is alpha blocker and alpha blocker, because phenoxybenzamine is basically used. And in case of the initial visit, the details were unavailable in case of this first study, so none of the other events are known, but the pre-operative period is basically 10 months for this patient, and the surgery was uneventful. As you can see, in all the cases surgery was uneventful. Then we had remote patient monitoring in this case, because this patient is basically a 26-year-old female who is pregnant. So as a result, so extra caution has to be taken. That's why remote patient monitoring is being done for this patient, so that we can get the details of every minute via the mobile application. Now let's come to the discussion of these particular articles. So telemedicine has three major types, that is synchronous, asynchronous, and remote patient monitoring. So these types are classified according to the timing of information transfer. That is, if it is transferred immediately, then it is synchronous telemedicine. So synchronous telemedicine is called as real-time interaction. So basically it is done in the form of video calls or telephone calls. Then asynchronous telemedicine is also known as store and forward TM. So it is about acquiring the data from the sender and then relaying it to the recipient. So it is basically in the form of emails. Then we have remote patient monitoring. As the name implies, it uses different technological devices or mobile applications or different types of applications to monitor and follow up on the health and clinical signs of the patients. So this is about remote patient monitoring. Then about the description of the study. So the case control study, which was being done by Heslin et al., it assessed the safety and efficacy of the preoperative telemedicine titration of alpha blockers for 14 patients compared to the control groups, where 14 patients were again there, but they were not receiving this follow-up via the telemedicine. So basically the authors reported that telemedicine arm had fewer pre-operative appointments and a shorter time to stop the alpha blockers when compared to the control group. So it is basically an advantageous point. And then by Saksa et al., that is the study which was being done by Saksa et al., Saksa et al., so they have said in the study, that is the patients have said that it has led to decreased driving, that is for the physical visit. So telemedicine is again found to be useful in that case, and then telemedicine also decreases the risk of infection, as most of the studies were done during COVID-19 pandemic. Now let's discuss about the challenges of the patient for selecting the patients who are suitable for telemedicine care. So this takes into consideration the following 3 points, that is, first, regulation and health systems settings pertaining to telemedicine care. Then availability of adequate infrastructure, that is in the form of devices and platforms for proper telemedicine use. Also the patient characteristics have to be looked for. So the patient's literacy, clinical stability, then medical history, and ability to use different TM platforms effectively has to be taken into consideration. And majority of the studies did not report any legal or ethical obstacles in their experiences with patients who accepted the telemedicine visits. Now, the article has also mentioned that even the patients with comorbidities were benefited from the telemedicine care. That is one individual, that is a lady who was pregnant, and also the individual who were, and also the individual who was actually having multiple comorbidities in the form of cardiogenic shock, hypertensive crisis, then heart failure, and that patient was also actually benefited with the help of this telemedicine. However, before doing all this, we need to explain the patient about the following life-threatening complications which can be associated even the patient was on telemedicine. That is hypertensive urgency or hypertensive emergency, and also they have to be mentioned about the different side effects of the medications which they are consuming, and how to use medical devices such as the BP measuring machines, and to provide easy access to appropriate medical care when needed, that is when TM is being used. This was about the discussion main part. Now let's discuss about the limitations. So due to the rarity of pheochromocytoma, because pheochromocytoma is a comparatively a rare disease, so majority of the studies which were included in this systematic review were actually case reports, and because of this they decrease the possibility of generalizing the results of the systematic review to a larger population. Also, there were no cohort studies and clinical trials in this particular systematic review, so that would have generated a better level of evidence. Then most articles, they did not report important clinical aspects such as the BP and heart rate control properly. So these are the limitations. Now finally coming to the conclusion. So this systematic review shows the convenience and safety of telemedicine use, as patients had a successful uneventful adrenalectomy without reported complications in all the 5 studies which we have seen so far in this systematic review. But since the number of individuals is this also the study design, that is they have not considered clinical trial or the cohort studies, so that's why further studies are needed to confirm this fact. Moreover, guidelines on the patient selection and procedure, that is they have to select the patient for the telemedicine for safe and effective medicine. So what are those guidelines that needs to be developed properly? So that is about this article. Now let's discuss about the critical appraisal of this article. So basically we are using the CASP checklist, that is critical appraisal skills program. So it is the CASP checklist for meta analysis for observational study, that is systematic review with meta analysis of observational studies. So as you can see here, the blue ticks refer that the article has mentioned properly about that particular point, and the red tick refers that the article has not mentioned properly about that particular point. So did the systematic review address a clearly formulated research question? Yes, they have addressed. Did the researchers search for appropriate study design to answer the research question? No, because here only case reports were included, no clinical trials, and no other prospective observational cohort studies. So as a result, that is a no. Then were all the relevant primary research studies likely to have been included in the systematic review? No, because they didn't do any hand searching, or they have not checked for unpublished studies. Similarly, then we have other points, that is screening of primary research studies from the search. So yeah, that was being done. Then selecting primary research studies to include in the systematic review, yes, done. Summarizing the research, summarizing the search and its output, that is also being done. Then coming to the next one, that is did the researchers assess the validity or methodological rigor of the primary research studies? No, they haven't measured that. Then did the researcher extract and present information from all the individual primary research studies appropriately and transparent? Yes, it is being done. Presentation of data is being done. Then did the researchers analyze the pool results of the individual primary search studies appropriately? No, because they have not mentioned about any p-values, the power calculation, and the sample size estimation for any of the articles, any of the 5 articles which are included in this systematic review. Then subgroup analysis was not done, meta regression was not done. Then the researchers, did the researchers report any limitations of the systematic review? Yes, they have reported. Then subgroup analysis and meta regression, again it is not done. Then would the benefits of intervention outweigh any potential disadvantage? No, that is also not that true. That is also not that clear, because it is not that effective. Then can the results of systematic review be applied to your local population? No, because in these the studies which were taken were having a very small sample size, so it cannot be generalized outside. Then we have, if action, would the findings from the systematic review represent greater or additional value of the individuals or population for whom you are responsible? No. And finally, what is the final conclusion of this systematic review, that is, can it be used to support evidence based decision making? No, because here we need good level of evidence in the form of randomized controlled trials. So this was about the general representation. So I hope you like my content. If you like my content, please do like, share, subscribe, comment, and also press the bell icon so as to get notified whenever I upload a new video. Thank you guys.